Hello, how are you? Everything all right? Anatomy studying going well? Fitting in with your other studies? Hope so. So what we're going to talk about today is we're going to look at a set of CT images, so a scrollable set of CT, computed tomography images of the pelvis. We've looked at the thorax, we've looked at the abdomen. This is actually the same set as the abdomen. This is abdomen and pelvis together. And we're looking at a male pelvis, because male and female pelvises are a little bit different. And I've got a male pelvis handy. And we'll be doing the usual things. For one, this is useful if you need to be able to recognize structures on radiographs. But two, this is useful to get us to apply our brains, our three-dimensional understanding of the body to two-dimensional images. By doing a little bit of work, we cement this knowledge, this understanding, this spatial awareness inside our own minds, don't we? So, okay, if we're going to look at the pelvis, what do we want to see? Well, okay, I want to see the bladder, I want to see the prostate gland, I want to see the rectum. Bonus things, well, okay, we will also look at the bones, I guess, some of the muscles and what have you. Those would be nice to see. Bonus things I'd like to try and spot are the ureters. The urethra we'll see, because we'll see the prostate gland. Try and follow the rectum back up and around. We'll be able to see the abdominal wall, so we might be able to see the inguinal canal. You know, the inguinal canal, that's how the stuff that goes to the testes goes through the abdominal wall to get to and from wherever it comes from and goes to and that sort of thing. Okay, so we've got some easy things and we've got some high value targets. Let's have a look, see what we can find. Here we are. So this is the same image stack that I was using for the abdomen on Wikimedia Commons, so it's in the public domain. You can do this too. Check the link below if it still works, if you're a long way in the future. The link might have died, but use your favorite search engine and see if you can find this stuff. So do you see where we are? We can see a whole load of easy to identify things and a whole load of difficult to identify things. I guess if we look at these first, look, so we can see the bones here. So here's the sacrum. Here are the bones of the pelvis. So up at this level here, look, these are the wings of the ilium. Right, so right at the top you've got the iliac crest, anterior superior iliac spine. You can palpate anteriorly. That's what we're looking at here and here. CT images are made by X-rays, so things that X-rays don't pass through appear as white. Things that X-rays pass through really easily, like air or fat, appear as black, and other things are graded in between. And the CT scanner moves around the body, creates a whole bunch of images, and those all get stitched together by the computer to create this. So white is bone, black is air. Right, so these then are vertebral bodies, the lumbar vertebrae, and if I scroll down you can see that we get to the fused vertebrae of the sacrum. In fact, if I go all the way down, so keep following it, boop, 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 it gets smaller, 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 and then we get to the coccygeal bones. The bright circles are bony bits here and there, because they're cut in a certain section, right? These are transverse sections. But these other circles that we can see, some bright, some not so bright, these are tubes that have been cut through by the plane of section. So these are blood vessels as a rule. Okay, scroll back up again. So we can see the vertebral bones, we can see the bones of the pelvis. So if this is the ilium here, as we scroll down, we would expect to see anteriorly the pubis. Scrolling down, 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 down. Oh, there it goes. There. So these are the bones of the pubis anteriorly then. So this is the standard way of looking at these sorts of images, is that this is the patient's left over here, this is the patient's right over here, this is their back, their posterior surface or their dorsal surface. We can usually see the thing that they're led on, and this is anterior, which means that their feet are coming out of the screen and their head is going into the screen. That's the standard, right? So that's what we're looking at here. In the pelvis, most of what we're looking at is symmetrical. Some of it isn't, but a lot of it is symmetrical. So it's maybe harder to determine. Right, okay, so if we continue looking at the bones then, this is the other thing that really jumps out, isn't it? This is beautiful. Look at this circle. So this is the head of the femur, articulating, I'm scrolling up and down there, that's articulating with the acetabulum, the socket of the hip joint, the ball and socket there. So if this is the head of the femur, we can see the neck of the femur, and then out here we're going to see the diaphysis as we continue to scroll down. Look, we can see the cortical bone on the outside and the spongy bone on the inside. Oops, I jumped back to the top then. Isn't that nice? Okay, and we can also see then the greater trochanters and the lesser trochanters and things like that. So if we've seen the pubis anteriorly, we've seen the ilium scrolling up superiorly. If we scroll down to the very lowest part, the bony bits that we sit on are the ischial tuberosities. So if I scroll down, 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 there's the pubis anteriorly. Now look posteriorly. These are the bony bits most inferiorly. That was the ramus linking the ischium with the pubis here. I'm probably saying too much, I don't know. Anyway, scrolling down, down, down. So these then are the ischial tuberosities down here that the hamstrings are attached to. So we can see lots of bony bits. The big muscular mass posteriorly will be gluteus maximus, and then we've got around here a lot of the other muscles of the, the lateral rotators of the hip and what have you. And as we scroll up, we can see the abdominal wall changing. I don't think we get this sort of appreciation other than in cross-section as to how this shape changes, but we'll come back to that later. Okay, what were my easy spots then other than the bones? The bones now I've kind of oriented you so you can keep an eye on the bones and you'll have an idea as to what level we're at. So there's one easy thing to spot there. That's pretty reliable. If I scroll down, there's a couple of other important structures down here. If I scroll down, okay, so here. From here, let's scroll up and keep your eye on it. Aha, you saw a little air space in there, right? And it's got some dark spaces around it. So keep watching this and we'll scroll up. So it's here now. Keep watching this. And it's a bit like, I'm scrolling down now. It's a bit like the 3-cup game, isn't it? Guess where the ball is. Keep your eye on the cup. Keep your eye on that. As we scroll up. Oh, look at that. Is it going this way a little bit? Lost it a bit. There's a lot of stuff around here, but okay, it's got a little bit lost for me in this mishmash of stuff. But what we were looking at were essentially, so closest to the skin, we would have the anal canal becoming the rectum. So the rectum is the last part of the gastrointestinal tract, really, and it's surrounded by, you can see that it's surrounded by fatty spaces here because the rectum fills with stool, so it needs a space to fill out into. So we often see this tube surrounded by these fatty spaces. So that's one way of identifying it. Now at this section here, we can actually see quite a bit. So up here, if I scroll up, we can see the bladder forming with some fluid within it scrolling up. And it kind of, see how it suddenly disappears because it's got this like flat top to it, right? So you scroll up and you go through the flat top and then poof, you're into all this. And this is all the small bowel, the small intestine that will fill any space available to it. So that's sat on top of the bladder. So if I scroll down, we've got bladder. So the bladder is up against the anterior abdominal wall. And as I scroll down, you can see that it is up against the pubis bones because the neck of the bladder is anchored to the pubis bones. Now, this being a male pelvis, if we scroll down from the bladder, we'd expect to see the prostate. You see this mass here? So this is the rectum, this is the prostate, and then the bladder is kind of just hanging over the prostate a little bit. So that mass there is prostate. This here is the rectum becoming the anal canal. So if I scroll down, we then get into the perineal structures here. So it's not massively, we can see an edge here, right? I was going to say, it's not massively circumscribed, really well delineated, but look, you can see some edges here. So the prostate gland sits inferior to the bladder. The bladder is anterior most, up against the pubis bones. So those are my easy spots. So remember that the urethra that's going to pass to the penis is running through the prostate gland. So, not really visible, right? Oh, maybe. Now the seminal vesicles, by the way, if you want to know more about the anatomy of the male reproductive system, go and watch that video first, then come back to this one. Then you'll have a better understanding of what it is we're looking for. But the seminal vesicles sit posterior to the bladder, and the ductus deferens will come around the bladder, like hugging the bladder. They'll come around the bladder, and the seminal vesicles will drain into the ductus deferens. The two ductus deferens then become the ejaculatory ducts and pass into the prostate gland, which means that, okay, so if we can identify the prostate gland here, if we follow it up, we kind of, so we see, so look, there's the rectum there. We see these masses posterior to the bladder. So there's the prostate gland. You can see the starts of the bladder. If we scroll up, the prostate gland ends, but it kind of looks like it blends with the seminal vesicles. It doesn't. They're separate structures. They've got capsules around them, or connective tissue around them at least. But that's where you'd find the seminal vesicles then, posterior to the bladder and anterior to the rectum. So we can see the seminal vesicles. That's pretty good. Now the ureters are going to come in from either side and go into the bladder. Sometimes they stand out, they're pretty easy to see. But do you see how, look, here and here, if I scroll up, so follow these things in and out. As I scroll up and down, we've also got, a number of blood vessels and tubes and all sorts around here, so it's difficult to work out what's what. What we're looking for is something that comes in from laterally, follow it as a tube, and then it passes into the bladder. I could jump to a couple of things and say, oh, maybe that's the ureter. But I'm not confident enough to point to a structure going into the bladder and say, oh, that's the ureter. You get a good radiologist or a radiographer, I bet they could, but I'm just a duffer. I'm just an anatomist trying the exercise of applying myself to these images. So if this is the bladder here, around here at this level and inferiorly, we're seeing a number of structures, so we'd expect to see the ureter coming in from laterally towards the bladder. But there are a number of other tubes, a number of other circles that we can see in there. Now the bladder is like, it's a vesicle, it's a bag filled with fluid. So the arteries and veins of the bladder are vesicular arteries and veins. So what we're seeing down here is we're seeing blood vessels running down to the inferior part of the bladder. Now what we can do is if we follow those up, we can see them branching from the major blood vessels as I go up. I don't know if you managed to follow these. So we're getting up into the abdomen now. We're out of the pelvis. We're in the abdomen, and what we can see is, here's the lumbar vertebra. So this is the aorta, and this is the inferior vena cava here. So the vein here, inferior vena cava on the right, aorta, pretty middle-ish here. And as we descend, we'll see those vessels. So look, there's the aorta splitting into left and right Sorry, that's left, that's right. So left and right, common iliac arteries. Then as we continue to descend, we'll see those arteries split again into external iliac artery and internal iliac artery. So now we're back in the pelvis. That external iliac artery is going to run anteriorly and is going to run deep to the inguinal ligament and become the femoral artery, right? We can see it branching again there. So this vessel here then, this is the vein medially. If we follow the vein back up again, keep your eye on it. You can see here, look, there's this one and this one come together, right? Continue to ascend, this one and this one will come together to form a new blood vessel. So those are the veins. This is the inferior vena cava, and if I scroll down so we can look at that again, we can see it splitting into common iliac veins. And then as we continue to descend, splitting and then splitting into external and internal iliac veins. If you watch the external, you'll see that go with the artery. But of course we're interested in the pelvis. We can see these on the pelvis section, but if I scroll back up again, we can look at the artery or the vein this time. But as we scroll down, you'll see for example, the aorta become the two common iliac arteries, and as we scroll down, split to become internal and external iliac arteries. The veins are here, and the internal iliac veins and arteries will run into the pelvis, and they'll give off all of those arterial branches to structures inside the pelvis, and they'll collect veins from all of those structures inside the pelvis. So as we scroll down, we can see quite quickly, I'm scrolling back up again now, you can see them coming together. But as I scroll down, you can see that this vessel quite quickly becomes lots of little vessels that disappear off and supply all the structures, and they're a little bit different in male and female pelvises. So that's the complexity of some of the tubes in the pelvis. Right, now we're going to go for some ultra cool bonus structures. Let's have a look at the anterior abdominal wall here as I scroll up. So we can see small intestine here. Now look, scrolling up. Up. Okay, so here we can see the abdominal wall muscles, the external oblique, internal oblique, and transversus abdominis muscle layers. Anteriorly, we can see rectus abdominis with the linea alba here. And you maybe get an idea of how the fascia comes together and blends around these things here. But let's have a look at the anterior abdominal wall as we scroll down. See if we see anything interesting happen. There's always interesting things happening. But going down, getting quite low now. What's this? What's this and this? If I scroll back up, look, we've got muscle here, muscle here, muscle here. And as I scroll down, we see a hole forming here and here. And as I continue to scroll down, that hole seems to move medially and then disappears. Kind of at the top of the external genitalia there. What is that? Scrolling up, what is that? That is the inguinal canal. That is that tube inside, or the tube that links the contents of the scrotum with the contents of the abdomen. So that's how the testes descended down into the scrotum, for example. That's how the blood vessels get to and from the testes and whatnot. This is the inguinal canal. Hang on, where is it? So if I scroll down, that's it there, it's appearing there. So we have a deep inguinal ring and a superficial inguinal ring. But does that give you a sense of a tube forming? So the tube is open this side. You maybe get a sense of that. Scroll down, follow the tube, and then the tube is kind of opening that away towards the scrotum and what have you. So that is a really cool thing to spot. That's a real bit of anatomy. It's one of those bits of anatomy that's very difficult to see in any way. Maybe this helps you appreciate it in a slightly different way, I don't know. Right, inguinal canal. Now the other one is another canal actually. Okay, so scrolling down, look at this shape here, right? Look at this shape here. You can maybe see the level that we're at, but look at this. Scroll down, scroll up, scroll down, here, scroll down, scroll up. This is serious bonus point territory, I think. Do you know what this shape is here? Can you work this out in your head if we're scrolling up and down and we're seeing that sort of shape? It's very difficult. This is the obturator canal. By that I mean it's this bit here, right? This is the obturator foramen, which in life is covered by a membrane, a connective tissue, leaving a little hole at the top, giving the obturator canal. The membrane is there largely to give muscles something to attach to. So we've got obturator muscles here as well. But look, if you look closely, you can see 3 little dots. So these are, boom, boom, boom. These are tubes that have been cut through. This is the obturator vein, the obturator artery, and the obturator nerve. Scrolling up, scrolling down, and they pass through the obturator canal to get into the medial thigh. I think that's really neat that you can see that. So we're in serious bonus territory here. But the obturator canal and the inguinal canal are visible, and you can see them in a slightly different way in these transverse CT sections of the body, which is just difficult to see in any other way. Right, there we go then. You go and do the same thing. Have a look at some individual sections, have a look at that scrollable image stack. Thank you so much for putting that into the public domain, those people that did that. And see if you can identify those structures. So we've seen the bladder, the prostate gland, we've followed the blood vessels up and down, we could identify the major bones. We looked at a couple of muscles but didn't do massive detail, so you can identify those as well if you want to. We can see the small intestine. On other images you might be able to see the ureters on other bits and bobs, but those are structures that you can see on a pelvis CT transverse image stack. Oh, did I say the rectum? The rectum and the fat around it and that sort of thing. So what we're doing is we're appreciating those 3-dimensional structures in a slightly different way and helping our brain out. Okay, right, good. Too much? Not enough? I don't know. See you guys next week.